Ever wished your house had eyes? Like, not in the
Oh.
creepy way, but like it could tell if you, left the oven on or something.
Yeah, I've been there.
It's like, why isn't there an app for that?
Right.
Well, that's kind of what we're talking about today, except instead of kitchens, it's hospitals.
Much higher stakes than burnt dinner.
Exactly. And we're diving deep into this CEO's blueprint for the smart hospital. And let me tell you, they've got some really, really interesting ideas.
Yeah, they really try to get past all the hype and talk about what's actually doable, right now.
Okay, so let's unpack this smart hospital thing, because I'll admit my first thought is just like a bunch of screens and gadgets.
For sure.
But I'm guessing it's a lot deeper than that.
Yep. Oh, absolutely. It's way more than just being connected. A true smart hospital uses AI to, well, it analyzes data, right? But it's about actually understanding what's happening. It's like how our brains take in all that sensory information, but then they have to, make decisions.
So it's not just about having the information, it's about making it meaningful.
Precisely. And then using it to make better decisions, anticipate problems, ultimately deliver better care. This isn't just like a new software system we're plugging in. It's a whole new way of thinking about how we deliver care.
We're talking about a complete transformation, not just a tech upgrade.
Right.
So where do we even begin with something this massive?
Well, this CEO, he argues that to make this vision a reality, you got to start with what actually works. We need proof, not just, promises. And this is where Dr. Fei Li comes in, with her vision for an ambient sensing hospital.
Okay.
She's incredible, by the way, real pioneer in computer vision.
Ambient sensing hospital. So that sounds like, I don't know, something out of Star Trek.
It does, doesn't it?
I'm guessing it's a little more, down to earth.
Well, maybe not that far off, actually.
Okay.
It's really about using AI to get a deeper understanding of, what's going on in the hospital, the environment. Like, how your phone can, like, adjust its screen brightness based on the ambient light, right?
Oh, yeah.
It's sensing the surrounding.
Yeah. So we're talking about hospitals that can kind of see what's going on and react.
Exactly. And the tech to do this, it's already here. Like, the CEO talks about AI that can actually analyze patient movements to prevent falls.
Really? Wait, how?
Pattern recognition. It's all about the pattern recognition. The AI analyzes data from cameras
Okay.
in the room, learns a patient's normal movements.
Wow.
So then if the AI sees something that's, off, like maybe they're having trouble getting out of bed or just moving kind of strangely, it can, like the nurse's station.
It's like an invisible safety net for patients at risk of falling. So it's not just reacting, it's almost like it can predict.
Exactly. And it's not just about falls. The CEO also talks about AI that could, help prevent bed sores. You know how important it is to turn bedridden patients regularly, right?
Absolutely. Crucial for preventing those pressure ulcers.
Right. And sometimes those turns get missed if, a nurse is slammed.
Yeah.
But imagine a system where, like, AI analyzes their position and then reminds the nurse when it's time. It's like, tech is a backup, not a replacement.
Right. Like giving nurses an extra pair of eyes,
Yeah.
an AI checklist so things don't slip through the cracks.
Exactly. And the best part, you don't necessarily need a zillion new gadgets to make this work.
Really. We're not talking about hospitals spending like millions on sensors.
Not necessarily. Take a company like Look Deep.
Okay.
They've got these vision AI agents,
Okay.
which are basically virtual observers.
Virtual observers. So instead of having a person stationed in the room, there's AI keeping an eye on things.
Precisely.
Yeah.
And the AI, get this, it can monitor multiple patients at once. Super efficient. They can even use cameras that are already there, like security cameras, to get the data.
So it's about like working smarter, not just throwing more tech at the problem.
Mm-hmm.
It's about how we integrate the AI. That's really interesting. It makes you think, though, if we can do all this with AI, what happens to the human healthcare workers?
That's the million-dollar question, isn't it? And it's one, the CEO, he really digs into it. See, he says the goal isn't to, like, replace humans altogether. It's to, empower them, right? What if instead of replacing nurses and doctors, AI could actually give them, like, superpowers?
Okay, superpowers. Now you're speaking my language.
Right. Imagine a hospital where AI can, like, help nurses, doctors get to the right patient at the right time with the right information. Boom. No more scrambling. Just bam, they're there, ready to give the best care possible.
AI handling all the logistics so healthcare workers can really focus on the human side of things. But that's a huge shift. And hospitals, they're complex.
Yeah.
How do we make sure this technology actually, like, gets put into practice well.
Well, that's where I think the CEO makes a really, really insightful point. He says we need to look at other industries that have already gone through, massive tech transformations, learn from their playbooks.
So, like, hospitals shouldn't be afraid to steal a few pages from, say, Silicon Valley.
Exactly. And he lays out three key lessons, three of them. The first is like openness. Think about smart homes, right? They work best when all the devices can like talk to each other.
Yeah, I'd be pretty annoyed if my smart lights and my thermostat were in a constant battle for control.
Right. It's about like interoperability. They got to play nice. And the same goes for hospitals. You need systems that can share data, work together smoothly, not these walled gardens where you're stuck with one vendor no matter what.
Openness. Got it. Okay, what's lesson number 2?
Evidence first. Remember when cloud computing started, like really taking off? It wasn't just hype. There were like, numbers, data. It actually was more efficient, more cost effective. And hospitals, they should be just as rigorous with AI.
Don't just jump on the bandwagon, make sure it actually delivers, right?
Exactly. Measure the impact, track the data, and only, scale up when the evidence is there, when you know it's actually making a difference.
Okay, smart. All right, drum roll, please. Lesson number 3, hit me with it.
It's all about being smart with the technology. Don't just like slap sensors on everything and call it a day. Sometimes the most elegant solution, it's the one that leverages what's already there.
Right. Like using existing security cameras to track patient movement instead of installing a whole new system.
Exactly. Be resourceful. Find smart ways to integrate AI into what the hospital already has. Don't create more complexity, right? We want to simplify things for the healthcare workers and for the patients.
Which brings up a really important point.
Yeah.
How do patients feel about all of this? I have to imagine some people are a little, unsure about AI being involved in their healthcare.
Oh, absolutely. And it's huge to acknowledge those feelings, right? I mean, interestingly, a recent survey found that the number one fear patients have about AI in healthcare, it's actually less face-to-face time with their doctors and nurses.
Yeah, that makes sense. The human connection, it's so important, especially when you're, not feeling your best, feeling vulnerable.
Exactly. And that's why we got to stress that this isn't about replacing that human interaction. It's about making it better. It's about making sure patients understand that this technology can lead to better, more personalized care. It's a good thing.
Finding that balance between like technological advancement and that human touch, that compassion. That's the sweet spot, right?
100%. And that's what's so exciting about all this, right? It's not just about the tech itself. It's about how we use it to make things better for everyone.
This deep dive has really got the wheels turning up here. I mean, if we can use AI to make hospitals smarter, what other parts of our lives could benefit from this kind of, intelligent assistance? It feels like we're just scratching the surface here.
Oh, I totally agree. That's the best part of exploring these ideas is like, boom, a million possibilities.
It certainly is.
Yeah.
And on that note of exciting possibilities, we're going to wrap up this deep dive. Huge thank you to all our listeners for coming on this journey with us into the future of healthcare. And until next time, stay curious, everybody.